Hi, Diana. I'm Bria, and I'll be assisting you a bit before your surgery today. How are you? That's great to hear. Well, I don't know if you know, but Mohs is an actually pretty old but very effective procedure that treats non melanoma skin cancers. Now, these types of cancers are actually the most common and are occurring more and more in young adults. Squamous cell carcinoma and your specific type, basal cell carcinoma, are actually the most frequently occurring forms of skin cancer. I'm not sure if you know, but that's when abnormal growths or ulcers in the deepest layer of your skin, specifically the basal cells, will appear. And as common as this is, that's what's so great about Mohs surgery. It has a 98% cure rate and the lowest rate of coming back after this procedure is done. Now, I understand that it can be a bit discouraging since this procedure is taking place on your face and can be the most difficult and tedious. But if caught early, like in your case, it will leave you cancer free while still looking your best beautiful. Now, does that sound like a good idea to you? Maybe something you'd be interested in? Okay, well, I'll go into next explaining the procedure itself to you. So basically, today, what you'd be going through is something called a biopsy, which is where stage by stage, the thinnest layers of your skin are removed by a dermatome. And then a specially trained Mohs surgeon is doing that procedure, of course. And then I'll temporarily bandage you while your skin is examined under a microscope by a technician. And this procedure will continue until no more skin cells are prevalent. This is done so that the least amount of healthy cells are removed or hurt in the curation process of the sick cells. It should be made understandable that because a very thin layer is removed and examined all in front of you at the same time, this process can either be very, very fast or it can take a bit of a longer time. But one person may only take a couple hours while your procedure may take 5 or 6. But that shouldn't make you feel any bit of uncomfortable. It's completely normal and completely different for different people. Sometimes cicatrices, which is a type of scarring, could occur from a procedure like this. But in your case, with a procedure that goes as well as this, usually light scarring is what occurs for most people. And always remember, just as extra options, things like dermabrasions or dermal audioplasties could also be options for you, just in case. Remember, though, you have to be very, very careful with your stitches after the procedure. You have to remember to take care of yourself and really put forth and remember that things are going to be better in the end. Then you can just come back into the office in about a month and we'll get you in, get you checked up, and make sure that everything is healing correctly and that no more skin cancer cells have surfaced. Do you think that this is a procedure that you would go ahead and want to go through with today? Great, Diana. Is there any more questions I can maybe answer for you to maybe make you feel a bit more comfortable or a bit more knowledgeable in the procedure you'll be receiving today? All right, well, that's great. Let's go on in.